Hi, nice to see you again.
Good to see you, bud.
Okay. Voy a entrevistar al Dr. Bob Cho, que es director del Hospital Rainer de Los Ángeles, para que nos comparta más o menos cómo es la vida de un director, cómo lo combina con la familia. What is life for a director of Rainer Hospital in LA? And what about your daughter, your wife? Can you match well?
Yeah, so it's a pleasure to talk to you. Mucho gusto. Life as director for Shriner's facility, it's a little bit of clinical, a little bit of administrative, and a little bit of other things. I like to say I'm probably 70% clinical and probably 70% administrative. There are not enough hours in the day, but you have to prioritize, just like anything else you do. So one of the things that I really try to make sure is to have a good schedule. I'm not very good at it, so I get people who are good at it to help me. I have 4 people who help me with my life at work, and all of those people make sure I'm in the right place at the right time. As far as with my family and my daughters, that is my most important job, as you know. And I make sure that every night I'm home and I have dinner with them. When I go home and I have dinner with them, turn the phone off. My staff knows, unless it's an absolute emergency, I do not answer email until they go to bed at about 8:30 or 9 o'clock. So I will not answer email, I will not turn on the phone, I will not open the computer. And I think that's the way you have quality time with your family. And then before you know it, they grow up and they leave your house, right?
Thank you. And speaking about your work in the hospital, how many children operate for year for scoliosis?
My career has changed a lot. When I first started at Shriners in Los Angeles, I was doing about 150 deformity cases a year, which is a lot. And it's easy to do when you're in your 30s, right? As you get older and things start to hurt, that's very difficult. Last month, I was doing four deformity cases a week. It was 3 smaller ones and 1 usually big deformity case for the last month. I can tell you that's very difficult. I think I can do that one month a year. I can do that 1 month a year. For the rest of the time, I try to do 1 or 2 deformity cases a week, and that helps me to do my administrative things. Thankfully, I have great partners. My partners also do spinal deformity, and I try to make them as busy as possible.
Okay. How useful are the SRS Congress for our patients?
So the SRS is great for our patients, and I'll tell you why. SRS is the premier organization for education and research for spinal deformity. As you know, as we learn the most current techniques, the most current research, as we stay honest about complications, what causes them, we can use that to help take care of patients and families better, to be more safe, and to take care of children and adults. Dr. Larry Lanke,
yes.
He gave a great lecture today about safety. This is, I think, the world's best spinal deformity surgeon, and he was so humble about all the things that he wished he did better. And that's something we can learn. How can we get better and stay honest and humble?
Thank you so much. What do you like most about being spine surgeon?
I love fixing 3-dimensional problems, and I love taking care of children. So put that together, that's spine surgery. I think it's the best discipline within orthopedics and neurosurgery because we get to use our hands, we get to fix things in real time, you get to use your brain, and you get to teach others, which I love to do.
And a personal question. What is the reason why do you decide to be a doctor?
Oh, it's because I'm too small to play American football. I would have done that instead, but since I can't do that, I have to do something else. I love science, I love art, and I think surgery combines a lot of that. I also love Legos, and what we do is making Lego blocks together. And so it is really learning how to take care of kids in a way that very few of us, I think, can do. It's a long learning process, but it's very rewarding because you make people better.
Thank you so much It's a pleasure to see you again.
It's great to see you.
I wait for you in Monterrey
All right.
in order to invite you a traditional roast beef.
Oh, I can't wait. I can't wait. I'm going to have some tacos too.
Tacos too.
All right.
Nice to see you again. Thank you.